Hello again, my name is Octavio, today's age-generated avatar. Welcome to our channel. We are glad you can join us. This is the third lecture of our series of Bruxism. Our lectures are developed by experts in their respective fields, using artificial intelligence-powered tools to do short and comprehensive lectures for patients, dental professionals and medical professionals alike. This lecture was developed by Dr. Nicolas Skarmeta, specialist in orofacial pain. In this video, we will be discussing how bruxism can affect dental structures and the extent to which it can cause dental problems. It is important to understand that tooth wear is not always related to pathological loss of tooth structures. In fact, in most cases, tooth wear is the normal process of tooth structure loss that occurs with age. Tooth wear is a cyclic and multifactorial process, with periods of remission and periods of more marked tooth wear. It is dependent on various factors such as daily exposure to acid, extrinsic mechanical wear, masticatory function, and tooth-on-tooth wear. Physiological wear does not cause functional, aesthetic, or tooth sensitivity problems. In fact, age-related dental wear is expected to be over 1 mm 1.7 mm in a 60-year lifespan. Pathological tooth wear is excessive tooth structure loss that can cause the following problems. Loss of tooth structure atypical for the age of the patient, which can cause pain and discomfort, producing functional problems, accelerated loss of dental structures, and deterioration of aesthetic appearance. Pathological deterioration of tooth structures can be extremely rapid, producing approximately 100 microns in less than 6 months. In pathological and physiological tooth wear, different types of wear patterns may usually coexist. That's why it's important to differentiate and identify wear patterns. It's also critical to distinguish pathological dental wear from severe dental wear. By definition, severe dental wear is a significant loss of dental structure, affecting more than a third of the clinical length of the tooth. This picture shows a patient with severe tooth wear, with predominantly chemical erosive dental wear, and also some facets that are consistent signs of wear produced by tooth-on-tooth contact. There are 3 different types of tooth wear. Dental erosion is the loss of tooth structure due to chemical substances, particularly to acid exposure, which can be caused by extrinsic factors such as acidic foods or drinks, or intrinsic factor, acid content coming from the stomach. Erosion affects the enamel and dentin differently, producing uneven wear on dental surfaces like occlusal cupping or incisal grooving, broad concavities. It may cause and increase the translucency on the incisal enamel edges, the presence of raised restorations, wear on non-contacting surfaces, and silky glass tooth appearance. Severe tooth wear is often related to dental erosion. On the other hand, dental attrition is a mechanical loss of tooth structure due to intrinsic factors, which includes tooth grinding or clenching. Attrition can result in flattened glassy facets or chipped teeth. Dentin and enamel wears at the same rate with matching wear and occluding surfaces. Lastly, dental abrasion is the loss of tooth structure due to mechanical extrinsic factors, which can be caused by overbrushing, using abrasive toothpaste, or chewing abrasive foods. Abrasion can result in wear located in the cervical area, especially around the gum line, predominantly affecting the posterior teeth, characterized by lesion more wide than deep. Conditions associated to tooth wear and dental pain. In addition to bruxism, there are several other conditions that can cause tooth wear. For example, oral dryness, which diminishes the lubrication between the teeth and the buffer capacity of the saliva, can be caused by the use of medication or systemic conditions such as Sjogren's syndrome, diabetes, sleep apnea, and gastroesophageal acid reflux. Oral dryness is often associated with mechanical and chemical tooth wear, dental pain, and tooth sensitivity. Conversely, dental erosion is the type of tooth wear more commonly associated to dental pain and sensible tooth. Acid reflux disease and eating disorders are often related to intrinsic chemical dental wear, erosion. Does bruxism cause tooth wear? While it's a common belief that bruxism can cause dental wear, the reality is that several studies show that the amount of dental wear is a poor indicative of the frequency of sleep bruxism. Tooth wear, in association with current history of teeth grinding, is helpful for discriminating sleep bruxism patients. Bruxism is more likely to cause signs consistent with mechanical wear, more specifically dental attrition. Regarding the evidence on bruxism and restoration failure, there is evidence to suggest that bruxism can contribute to restoration failure in certain cases, particularly with ceramic veneers. Nonetheless, evidence is conflicting and scarce regarding the possible complications in dental implants, failure in other restorations, and periodontal disease. Some articles suggest that it could be possible that bruxism might have some deleterious effects for dental implants. In summary, tooth wear is often mistaken as an unequivocal sign of bruxism, often disregarding if tooth wear can be pathological or physiological. Tooth wear associated to bruxism is often related to mechanical intrinsic tooth, dental attrition. It is important to understand that tooth wear is often multifactorial, and that severe tooth wear is often related to chemical factors, such as medical conditions or the intake of acidic foods. Thank you for watching this medical lecture on bruxism and tooth wear. If you have any questions or comments, please feel free to leave them in the comments section below, and we'll be happy to respond. If you like our content and want to continue learning about different medical topics, please subscribe.